Jane is a 17-year-old high school student with chief complaint of right lateral ankle pain. She reports this happened 3 days ago during a basketball game when she landed on another player's foot and twisted her ankle. She says there was immediate, sharp pain, but no popping. She said she needed help getting off the court and has been using bilateral axillary crutches ever since. And she says pain is 7 out of 10 at worst, 2 out of 10 at best, and after pain medication and icing. Past medical history: she's had left patellar tendinopathy. Medication: she takes 800 milligrams of ibuprofen 3 to 4 times a day. Zyrtec and Cymbalta for allergies. For red flags: she has pain on the distal portion of her right lateral malleolus, and this has been cleared by her doctor. Yellow flags include catastrophizing and fear of movement. She presented to the clinic today with bilateral axillary crutches and not weight bearing on the right, with a compression brace on the right. With sit-stand transfers, she uses her arms and avoids weight bearing on the right. We know that there was bruising and edema in the distal aspect of her right lateral malleolus and edema going into the foot as well. Figure 8 test shows she had 2 centimeters larger on the right than left. She had mild to moderate tenderness on her ATFL and CFL. She had pain in active and passive range of motion and decreased active and passive range of motion in all planes. Special tests include anterior drawer, which is positive for instability. Talar tilt was not done because of pain and range of motion restrictions. My best hypothesis would be grade 2 right lateral ankle sprain. I would recommend starting with education for her fear and possible counseling, and then I'll begin with gait training, weight bearing is tolerated with bilateral axillary crutches, and active range of motion exercises. Do you have any more questions before I begin?